My name is Elizabeth Daly, and I am the Executive Director of the National Foundation of Swallowing Disorders. Our goal with the Meet the Makers series is to offer our community access to those who have created products specifically for people with swallowing disorders. Our goal with the Meet the Makers series is not meant to be promotional, but rather informational. We want to give you the opportunity to ask the creators of these products your questions, learn more about how these products help people with swallowing difficulties, and make connections so that your voices feel appreciated among our industry partners. We thank you for joining us this evening, and we hope that you find this series to be helpful. The makers in this series are volunteering their time to share this information. They have not paid to participate in this series, nor was it required that they be a past or current financial sponsor of the foundation. If you have participated in an NFOSD webinar previously, you're likely familiar with our system. You will be muted throughout the whole presentation, but are encouraged to ask questions at any point. There are 30 minutes reserved on this call for questions, so please don't be shy about asking. ASHA CEUs are not offered for this webinar. You can receive a certificate of participation upon completion of this broadcast by completing a 2-minute survey that you will get in your email. We do have permission to record this broadcast, and we will make it available in the coming days. I want to provide a reminder that tonight's broadcast is for informational and educational purposes. Both the NFOSD and tonight's speaker do not intend to provide any diagnostic or treatment advice or recommendations. If you need assistance identifying a swallowing specialist, please reach out to us via email. And now it's my pleasure to introduce tonight's speaker, Lindsay Stevens from Parapharma Tech. Lindsay is a speech-language pathologist with over 23 years of experience, specializing in pediatric feeding and swallowing disorders, currently serving in a Level 3 NICU at Dignity Health St. Joseph's Hospital and managing her own private practice. In addition to her clinical expertise, Lindsay draws on her personal experience raising 2 children with dysphagia to support families and clinicians worldwide. And with that, I want to thank Lindsay for volunteering her time tonight, and I'll turn this over to her.
Thank you so much, Elizabeth. It's so great to be here with everyone, and our organization thanks you for inviting us and having us on tonight. So, and thank you to all of you who are watching or will watch. We are excited that you want to learn more about our products. So, as she mentioned, I am a speech-language pathologist. I've practiced for over 23 years now, and I'm also the medical facilities manager for Parapharma Tech. So, our company makes Gelmix and Purathick. So I'm going to show you our presentation tonight. And Elizabeth, I just want to make sure that you all can see it.
Yes, not yet,
okay.
But give
awesome.
me a second.
Okay.
Yeah. There we go. Yep, now I can see your
excellent.
screen.
Okay, great.
Excellent. Go away.
Yes. Okay, so our company, let me just reduce this here. I am just seeing myself and not my screen.
Oh no, we can see your screen, but if you minimize yourself.
There we go. Yep. All right. I am obviously a little unfamiliar with this platform, but okay. So this is Dr. Enrique Hernandez. He is a pediatric gastroenterologist out of South Florida. So he and his wife, Nicoletta, started this business and created Gelmix back in 2010. I'm going to talk a little bit more about Gelmix, and they also created Purathick, which is our thickening product for anyone over 1 year of age. So pictured in the middle here is our COO, that's Melissa Malone, and not pictured is our CFO, and that's Luis Vargas. So this is a small team who came together because they saw a need for an alternative to infant cereal for infant regurgitation. So historically, people have been using infant cereal to thicken feeds for regurgitation and for dysphagia. But there are a lot of problems with infant cereal when we think about thickening feeds for a young infant under 1 year of age. Okay. So as I mentioned, we have Gelmix and Purathick. So our thickeners are unique in that they are natural alternatives to the current thickening agents that are out there. Now, most of you are familiar with thickening and thickened liquids, but essentially our product is an alternative to those that can make a thin liquid thicker. Generally, when you make a thin liquid thicker, it goes down more slowly. It provides more sensory information to the back of our pharynx and our brain, and helps that swallowing reflex start more quickly. So one of the unique things about one of our products, Gelmix, is that it is the only thickener that can safely thicken breast milk for infants under 12 months of age. Now, in the past, when people would try to thicken feeds for an infant who was experiencing regurgitation or dysphagia, the infant would have to come off their breast milk and start on formula, so then infant cereal could be added. So we all know, and the AAP recommends, that breast milk be continued when possible and offered as an exclusive diet for infants if possible. So the use of Gelmix has been a game changer in this field. So when it comes to the variety of options for thickening agents, we know that there are a variety of options, right? There are xanthan gum products, there are cornstarch products, there are products that combine those two ingredients. For infants, there is infant cereal, and there are also rice starch formulas, or formulas that have added starch to them. Now, for infants under 12 months of age, these thickeners that I just mentioned are contraindicated. So that brings us to learning a little bit more about Gelmix. So Gelmix has 3 ingredients: organic tapioca maltodextrin, organic carabine gum, and calcium carbonate. That's all. So you'll notice other ingredients have either long ingredient lists or a lot of ingredients that are not necessarily good for the body. So Gelmix was created specifically to thicken breast milk and formula for infants under 12 months of age. It can be used for anyone older than 12 months of age. It's just that it was designed specifically for that population. Gelmix can be used in infants who are born term gestation, which is 37 weeks and above, and they also have to weigh at least 6 pounds. Now, Gelmix can also be used in our infants who are born prematurely, so those infants born before 37 weeks. But those little ones just have to weigh at least 6 pounds and reach a corrected age of 2 weeks, which is the same thing as 42 weeks postmenstrual age, or 42 weeks corrected gestational age. So the main ingredient in Gelmix is what makes it unique. Carabine gum is a substance that's been, or I'm sorry, is a natural seed gum derived from a plant, and it's been used safely with infants under 12 months of age in the United States and in Europe for a long time. So as I mentioned earlier, Dr. Hernandez created this product in 2010, and it's been used for infant regurgitation and for dysphagia. So there are a lot of literature reviews and studies showing the safety of carabine gum, and a link to some of that information can be found on our website if anyone's interested. So you can reach our website at www.healthierthickening.com. You can also reach us at gelmix.com. So Gelmix has a variety of advantages when it comes to other thickening agents. It is tasteless, odorless, it's smooth. It literally just dissolves into warm liquid and makes the liquid thicker. It does not have a significant amount of calories or carbohydrates, and it does not significantly displace the volume of the liquid. So these two things are very important when we have a little one drinking their formula or their breast milk, because they need to get all of their nutrients, their macronutrients, their micronutrients, all the vitamins and minerals from their breast milk or their formula. And our product doesn't significantly displace the caloric density or the volume. Our product is also organic, it's hypoallergenic, it's GMO free, it is also kosher, vegan, and halal. So Purathick is our product that was born in 2016, and the company saw a need for this product for anyone over 1 year of age who was experiencing dysphagia. So Purathick is also has 3 ingredients. Both products share two of the same ingredients. So both of them have organic tapioca maltodextrin, and both of them have calcium carbonate. Now, the main ingredient in Purathick is Terra gum. Terra gum is also a natural seed gum derived from a plant. But Terra gum has not been studied in infants under 12 months of age. So that's why Purathick is for anyone 1 and older. So this would be your products you would use for someone experiencing dysphagia who's 15 months old, 16 years old, or 95 years old. Purathick also has a lot of advantages over other thickening agents. It also does not have a significant amount of calories, carbohydrates, and it also does not significantly displace the volume. So again, very important when we have someone drinking a supplement or water or anything that they're consuming that they need to get hydration and calories from. So Purathick is also GMO-free, also hypoallergenic, no gluten, dairy, corn, or soy, also kosher certified, vegan, and halal. And very importantly, for those who are drinking thickened liquids, it does not have a flavor. So we really want, when we have someone on thickened liquids, it's easy for them to not want to drink their thickened liquids because they're not very palatable, or they have a flavor, or they leave a residue in the mouth. And Purathick doesn't do any of those things. Very, very palatable. It tastes like whatever you add it to, and it stays the same consistency over time. Again, another advantage over other thickening agents that can change consistency over time, whether it's thinning out or thickening up. Our product stays the same consistency. So these are some of the highlights I just mentioned as far as only having 3 ingredients and being hypoallergenic. Again, our products can be used for anyone 1 and older. So cornstarch products generally shouldn't be used until a child is 2 to 3 years of age, depending on the manufacturer that you're using, and our products can be used younger. So cost-wise, our products are very comparable to the leading brand of xanthan gum. And changing to our products is a no-brainer then, because our products are healthier than xanthan gum products. Purathick also can thicken liquids that others can't. So some of these liquids are listed here, or shown here. And for Gelmix, our product for infants under 12 months of age, we have spent a lot of time and effort in creating specific recipes for most of the commonly used formulas on the market, for the infant formulas on the market, and also with multiple donor breast milk. So we have specific recipes that tell you exactly how much to use and exactly how many ounces with the exact wait times. So please definitely go to our website and check out these recipes. All of our recipes for both Gelmix and Purathick are consistent with the IDSI framework, and we definitely endorse the flow test. Now, when it comes to purchasing our products, if you work in a healthcare facility or a clinic, we do offer wholesale purchasing. We are contracted with major distributors, McKesson Medical Surgical and US Foods. And if your facility is not contracted with those, I mentioned we do offer wholesale purchasing options through our website. Now, we are also available internationally. So we are available in Canada, Hong Kong, Singapore, and Qatar. And we also recently became available in Saudi Arabia. And you can find this information on our website as well at www.healthierthickening.com. So our products are covered by insurance sometimes, and we do have letters of medical necessity on our website for doing that. When a patient is Medicaid eligible, and their state is not covering our products, they can receive a 40% discount through our We Care program. This program, as I mentioned, provides 40% off of the retail cost of our product, or products, I should say. The application for this program is on our website. It's our internal program, and these applications are reviewed within 1 to 2 business days, and then our company lets the applicant know if they were covered or not. So this is a really, really helpful program for those that may have a hard time paying for thickeners. Our products, I mentioned, are occasionally also covered by private insurance companies. Now, when it comes to a family who is not using insurance or they're not eligible for Medicaid, our products are available through our website and also through Amazon. And the most cost-effective way to purchase our products out of pocket is to go through our website. And that's because we offer free shipping and monthly coupons that will make our prices lower than Amazon. Okay, we have lots of support that we offer. I offer free information, education seminars, webinars, basically, that can provide a lot more in-depth information about the rationale for thickening, the indications for it, the research behind it, how our products have been used in multiple different studies. And I can also offer a lot of practical tips for implementation and some guidance for healthcare facilities trying to implement our products at their location. We also have an infant feeding support group on Facebook. We are on Instagram and TikTok, and we do provide free samples to healthcare facilities. So please don't hesitate to reach out to us. You can also contact me directly with specific questions about using our products. Okay, so that concludes the formal aspect of what I wanted to share with you today. So I wanted to open it up to any questions that I can answer for everyone.
And thank you, Lindsay, for that presentation.
You're
That was
welcome.
really helpful. I'll give you a few
Welcome.
seconds here for questions to come in.
Yes.
But to start up with here, a question about the pediatric thickener. If you're thickening breast milk, is there a certain temperature that you need to thicken it at? And if it sits out for a while in a bottle, how long is it still good for? Can you talk to that?
Definitely, excellent questions. So essentially, when we say on our label that the liquid needs to be warmed, it needs to be warmed to at least body temperature. And the lowest range of body temperature is 95 degrees. Our labeling says 100 degrees, but that's just kind of like a general suggestion. Okay, so in our NICUs and in our hospitals, if we're using bottle warmers, our bottle warmers are generally not getting to 100 degrees. So it just needs to be warmed to at least 95 degrees. 98 degrees would be ideal. So you add the Gelmix to the warm breast milk, you shake it for 30 seconds, you let it sit for 10 minutes, and then you shake it again for 30 seconds after that wait time. Now, the bottle can be prepared ahead of the feeding time. And this is really helpful for nurses who have multiple babies who are feeding at the same time, or at different care times that are clustered together. So the Gelmix will stay good as long as the liquid stays good. So if you would leave breast milk out at room temperature for 1 to 2 hours, the Gelmix is going to stay the same. Now, Gelmix does minimally thicken over the first 30 minutes, but it doesn't thicken outside of the thickness or the viscosity range. So if you're familiar with the flow test, the IDSI flow test or the syringe test, there are variations within a slightly thick consistency, a mildly thick consistency, and a moderately thick consistency. So generally, you'll find that the liquid thickened with Gelmix will thicken within that range within the first 30 minutes, and then it will stay stable and it will not change over time. Okay. You also can thicken liquid ahead of time and put it in the refrigerator or the freezer, and then take it out and thaw it or rewarm the liquid to reach that intended viscosity. We generally don't recommend doing that with breast milk because breast milk should only be warmed once, but you can do that with thickened water that you're going to mix with powder formula later or ready to feed formulas.
Okay. So if you pump the breast milk and then thicken it and then refrigerate it to heat it later, once you reheat it, do you have to let it sit for another 10 minutes or would it be good to go right after
If
that?
you thicken it straight from pumping, so you know, mom's breast milk straight from the pump, adding that gel mix while that liquid is warm, don't allow it to cool, then you can thicken it, refrigerate it, and then rewarm a bottle, and that would be only warming once.
Okay, excellent. Thank you for that. Another
Yeah, you're
question
welcome.
about the safety of the product with the carabine thickener. Why is this safer than xanthan gum? Saying that they know xanthan gum is often used in baking and didn't realize that it was unsafe.
Yeah, so xanthan gum there about 15 years ago, the leading brand of xanthan gum was used in infants under 12 months of age, and these infants were term and some of them were preterm. And what happened is several of these infants developed really severe intestinal problems. So several of them actually developed necrotizing enterocolitis, which is bowel death that requires surgery, and several of the infants actually passed away. So there have been studies since that time kind of trying to see what is it about xanthan gum that can be problematic for an infant's gut. And some researchers have proposed that basically the thickener can separate from the milk and cause solid formation of solid precipitant, the liquid can precipitate and cause solid formation. So basically separating and the tendency to precipitate can put the infant's gut at risk of having some of these GI issues that are very scary and serious for young infants. So, so xanthan gum should not be used in infants under 12 months of age. And carabine gum has been studied in infants under 12 months of age. And according to the studies, our guidelines using our product for term infants 37 weeks and above and weighing 6 pounds, and those who are preterm waiting until 42 weeks post-menstrual age and weighing 6 pounds, those guidelines are out of an abundance of caution for keeping the infant's gut healthy. So that is the reason that you should not use xanthan gum in infants under 12 months of age.
Excellent. Thank you for explaining that. It's important to understand.
You're welcome.
Question here asking about the recipes for Ensure and Boost and other supplements like that. What is the best way to thicken those?
Yeah. So the ones that are, well, so our recipes are on our literature and on our website for Purathick. And generally, we offer a range of volumes. So I don't have an image here, but so essentially, I'm just off the top of my head, let's just say you use 1 stick pack of Purathick or 1 scoop of Purathick in 4 to 6 ounces for a slightly thick consistency. That's not the actual recipe. I'm just using that off the top of my head. So the reason we we provide a a volume range is because all liquids are not the same starting viscosity or thickness. So water and breast milk are thinner than a whole milk or a formula or a supplement like Boost or Ensure, okay? So if you have a thinner liquid like water or juice or a supplement that maybe doesn't have any milk protein in it and it's a thinner viscosity, then you should use the smaller volume, okay, like 4 ounces. If you have a liquid that is thicker naturally, like a milk or like one of those supplements that have milk protein, even a partially hydrolyzed milk protein, those should be used for the larger volume. Okay, so we hope to in the future have specific recipes for the majority of different supplements that are used really commonly, so there isn't any guesswork, because we know that someone may be safe for 1 scoop of Purathick in 4 ounces and maybe not safe for 1 scoop in 5 ounces. So we're trying to develop those just like we did for Gelmix. But in the meantime, use that range, knowing that different liquids have different starting thicknesses.
Excellent, thank you. I did want to jump back to our last topic when we were talking about pediatric thickening. We had a follow-up question asking about the difference between under 1 year old and over 1. Is there a hard cutoff? Is it kind of a weight criterion? Is it consult with your team and see what works?
Yeah, I always am going to recommend consult with your team. Okay. You know, having practiced for 23 years, there's always those individuals that are complicated medically, that maybe there's some contraindications to thickener in general. And so you want to work together with your aerodigestive team, your gastroenterology team to make sure that you're making the best recommendation for that patient. Now, the 12 months of age is chronological age. So if you have an infant who was born preterm and they chronologically have reached 12 months of age, they can use Purathick now. Some families who are using Gelmix, they opt to just stay on Gelmix because it's worked for their baby for such a long time, and you don't have to stop it at 12 months of age. Okay, so I hope that answers that question.
Yes, I think so. Thank you. A
You're
question
welcome.
about doing assessments, and you work in the NICU, so maybe you can add to this. If you're doing a swallow study or a fees with an infant, do you use Gelmix during those studies? I guess maybe let's start with video fluoroscopy.
Yeah, so you can. I worked at Phoenix Children's Hospital for a very long time here in Phoenix, Arizona, you know, working with a variety of different ages. And now, as I mentioned, I'm in 2 different NICUs. So it depends on your facility. We have always used, or I should say, I have always used the actual barium, Varibar barium, because it's standardized. You know, their recipes are, or their barium is consistent with the IDSI recipes, or thicknesses, or viscosities, I should say. But you can, and I know some facilities are doing that. So if you're in the radiology suite, you would just warm the barium, like the ultra thin barium or the thin barium that you can create that ultra thin consistency. And then you can add the Gelmix to it, shake it, let it stand for 10 minutes, shake it again for 30 seconds, and then it should be ready to go. Hopefully in the future, we will create specific recipes for that, but I do know a lot of facilities are doing that, so they can see exactly what the baby would do, you know, with that specific thickener.
Excellent, thank you. Sorry, I think there might have been a lag in my internet here. I think it's an issue on my end and not yours, so I apologize if you were sitting there in the silence for a second. I wanted to jump to another question here. How can people figure out if Medicaid covers thickeners for their child?
Oh, you cut out. I heard you say, how can people?
Oh, I'm so sorry. I had a question.
Said, well, all I heard was, how can people? And
Hopefully you can hear me here. The question is, how can
sure.
people discover whether
I
Medicaid
know
covers
it's
their
cutting out.
thickeners?
I heard it. Okay. So it depends on your state, and what you can do is you can use one of our letters of medical necessity, have the healthcare provider complete that letter, and then a physician generally signs it. So if it's an inpatient, the medical team will sign it. The case manager generally should help with that. If it's an outpatient, then the pediatrician or the primary care doctor would sign that letter and fax it to the insurance company, and then the insurance company is going to determine if they're going to cover it. So there are some states where we know they're covering for Medicaid, and then there are some states we know they're not. We do have a list of those on our website. So if you go to healthierthickening.com and you look at where to buy, or healthcare professionals, I believe, off the top of my head, but you can look for the list there, and it'll show you state by state what's covered. You also can just reach out to me and I can help you with that. You can reach me via email, lstevens@healthierthickening.com or lstevens@parapharmatech.com. You can also reach out to us, customer service, and they'll get your question to me as well.
Excellent, thank you. That's a helpful information to know. This is mostly a comment from a member of the foundation who had shared that when given the option of thickening their liquids or staying on their feeding tube, they opted to stay on their feeding tube because their formula was covered, but they couldn't cover expenses for their thickener.
Right.
Kind of a
Yeah.
comment.
And we know as speech pathologists, that, you know, it's beneficial for people to continue to use those muscles, right? An infant needs to continue to develop those feeding skills because it's very much a critical phase of their development. If they are not feeding by mouth during the first, 12 months, 0 to 6 months, then they're going to lose out on a lot of critical skills that they need to move on to, whole foods and foods by spoon and chewing and things like that. And then, adults, even though our motor pathways and development has been established, it's the only practice for swallowing is swallowing, right? So we, the company, recognizes that and wants to ensure that there's a thickener that's safe for people, that is very palatable. We actually won an award in Canada for the best tasting thickened coffee. Our product, or I'm sorry, Purathick thickens alcoholic beverages. So really important to keep people hydrated and happy and enjoying that quality of life.
Excellent. Thank you for advocating for that.
Yeah.
Does Purathick thicken carbonated beverages?
Yes. So I've played around with this a lot myself, and my dad actually ended up having to be on thickened liquids toward the end of his life, and he was on Purathick, and he used to have his Diet Coke every day with Purathick, and he would drink 64 plus ounces of water with Purathick, and that's not with anything in it, like he wouldn't have lemon or lime or anything like that. So it does change the carbonation slightly, but it's better than a xanthan gum or, of course, a cornstarch that's going to just kind of take all of that carbonation out. So we recommend, if you want to mix it with a carbonated beverage, that you, add the Purathick to the carbonated beverage, shake it in a closed container, or use our frother that we recommend for 30 seconds, and then you're going to let it stand for a very short wait time, but then you want to let it stand a little bit longer just to make sure that when you open that container, it's not going to explode on you. Now, if you're using the frother, you don't have to adhere to the longer wait time for the carbonation because you can do it in an open container.
Okay, excellent. That's a good tip. I remember when I was completing my clinical fellowship year, supervisor really encouraged experiential learning, and I had thickened at the bedside somebody's carbonated beverage and closed the cap and shook it up real good.
Yes.
And it exploded everywhere.
And we've all had that as speech pathologists, right? Like trial and error. Even if someone tells you, you're kind of like, oh, let me just see how it goes. It's also super helpful if you've ever been to a conference that we've been exhibiting at. Try our products. We give samples of thickened alcohol beverages and thickened, orange juice and things like that to show the difference between how ours tastes versus how others taste and leave. Others can have like a slimy mouth feel, or they can be gritty or grainy and leave a residue in your mouth, and our products don't do that.
Interesting. Have you ever done like the Coke versus Pepsi taste challenge with other thickening?
That's a great idea. No, we have not, but that's a great idea.
I typically wouldn't ask personal questions, but since you included in your bio that your children had dysphagia, is that something that you're willing to talk a little bit about?
Oh, sure. Yeah, definitely. So I started as a speech pathologist before I had kids, and then I was pregnant with my daughter, and I was actually in the NICU at that time. She's 14 now, almost 15. And I was experiencing some difficulties with the pregnancy. So she was intrauterine growth restricted, and I ended up having gestational diabetes, and she wasn't growing and all sorts of issues. So anyway, she experienced dysphagia as she was breastfeeding, and I was in denial for the longest time because I was like, how is it possible that, this is my field and that I'm having a baby with those problems? But God works in mysterious ways. So I was definitely prepared for her. So she ended up having instrumental exam and was aspirating up to moderately thick consistency. So she had to be on thickened liquids for about 2 to 3 years. Now best practice is not to have infants and young children on thickeners for that long of a time, right? So now we do thickener wean, and we always have a plan for a child or an adult who's going to be on thickened liquid to get off, right? So anyway, so then she also experienced some feeding difficulties and had poor weight gain, and she ended up having some food allergies and just a variety of different things. So I'm so thankful for Dr. Dana Williams at Phoenix Children's Hospital and the Air Digestive team there, because they helped me put on my mom hat and take off my speech pathologist hat and help her. And then my son had very similar issues as well. So they both are still pretty picky. Thankfully, they're not problem feeders, but it's still a challenge to feed them and to make sure that they're getting nourished and to, get all the macro and micronutrients they need. So, so it was ironic that this happened to me, but again, I was prepared to be their mom.
Thanks, Lindsay, for sharing that. It's great to hear that they're
You're
doing
welcome.
so. Yeah, and that had to be
Thank you.
hard days to go through. Yep.
Yes. Okay. Yes. It's still a work in progress. Excuse me. My son, they're both still on appetite stimulants, and my son actually we just found has more food allergies than we expected. So back to GI and back to the journey.
Wow. What would you say to a parent who has a child who's newly diagnosed with dysphagia or feeding challenges? What advice or tips as a mom and a parent would you give?
Yeah. So it's not the end of the world. This too shall pass, especially when infants are experiencing dysphagia or feeding difficulties. Dysphagia is a symptom of something else. So a baby doesn't just have dysphagia. And feeding difficulties, are generally the result of something else happening. So I would just say work with your medical team to get to the bottom of what's happening. Find yourself an experienced speech pathologist or occupational therapist who has feeding therapy experience, and help them kind of partner with you. It takes a village to help a little one grow and develop, and that's especially the case when we have a little one who's experiencing dysphagia or feeding difficulties, or both. So definitely things change, things improve, and just really collaborate with your team and ensure that your team is using a parent-focused team strategy and working collaboratively with everyone on the team.
Excellent. Thanks for sharing that. I have another question that came in here asking if you could discuss the use of bottle nipples with thickened liquids. You need to use a slightly faster flow rate when you're using the thickened liquids, and how do you figure out which one to use?
Yes, yeah. So that is very complicated. There are so many different bottles and nipple flow rates on the market, and they're all kind of advertised differently. So some brands will say, oh, use this nipple if your baby's 0 to 3 months, and use this nipple if your baby's 3 to 6 months, or 6 to 9 months, 9 to 12 months. And then others will say, level 1, level 2, level 3, or slow flow, medium flow, fast flow. So even though you might have 2 brands of bottles and nipples that say they're both slow, they generally don't flow the same. So nipples flow differently based off a variety of things. So one of them is like the texture of the material that the nipple is made out of, obviously the hole that's in the nipple, or the slit that's in the nipple, or the amount of holes that are in the nipple. And then it also depends, I'm not listing all the factors, but it also depends so much on the baby, right? So you can have one baby taking Dr. Brown's preemie nipple and a different baby using a Dr. Brown's preemie nipple, and they both can kind of have different outcomes with those nipples. So if you have a speech pathologist, a feeding therapist on board, use them to help you, because it's generally not, so like if you're thickening liquids to a level 1, slightly thick consistency, it's not always a specific nipple, right? It depends on the baby. Now, if you're at home and you're not connected with a speech pathologist, and let's say maybe your baby's on Gelmix for regurgitation, then you can generally use a medium flow nipple for a level 1 and a level 2 consistency. You will need a fast flowing nipple if you're creating a moderately thick or level 3 consistency. But it's really important that you have a medical team involved, a speech pathologist or a feeding therapist involved, because sometimes if the flow rate is too fast, then the baby can have difficulty swallowing, even though it's thickened, and then they can, still have some of those liquids going into their airway. If it's too slow, then the baby will struggle to get it out, and they might fatigue or kind of fall asleep and shut down. And then we see babies start to take less and less over time. And of course, that can lead to dehydration and malnutrition and all sorts of problems. So very important when you're on a thickened liquid for dysphagia to have a speech pathologist involved to help you figure out the best utensil.
All right, thanks. It's kind of a complicated topic, but I appreciate that
information. It is. Yeah. And then
go ahead.
I was just going to say that the bottles are kind of advertised in a way that make you think that you need a faster flow nipple as your baby grows. But I've seen lots of infants who are on slow flow nipples, and they stay on a slow flow nipple their entire kind of bottle feeding career, right? So they don't have to go to a faster flow if they don't need to.
Thank you. And I will speak from experience as a mom. I didn't realize there were different size nipples when I had my first child, and so he had the same one the whole go, and it worked out just fine. Yeah.
Yes.
Yeah. Things you learn. I do have another question here, but I just want to remind the audience that you can type in any questions at any point here. I have a question from a person with dysphagia, going back to something that you had mentioned earlier during the Q&A, saying that thickened liquids aren't meant to be a forever thing. Were you talking just for pediatrics or across the age spectrum?
Across the age spectrum. And so keep in mind that thickened liquids are used for dysphagia in different ways. So it should be very individualized. So one person with, one adult with dysphagia may be experiencing it for certain medical complications versus another adult using it for maybe just a single medical issue. So it definitely varies. Whenever we are utilizing, well, let me go back. As a speech pathologist and feeding therapist, we don't always jump straight to thickening, right? We have a lot of different tools to manage dysphagia, and a lot of those tools are, not thickening, basically. So there's different exercise and maneuvers, there's different positions, there's different things we can do to limit the bolus size or the amount of liquid that the person gets in their mouth when they're drinking, whether it's from a bottle or a cup or a straw. So lots of things we can do before thickening. But when thickening is indicated, it is an evidence-based intervention for reducing laryngeal penetration and aspiration. And that's when the liquid goes near the airway or down into the airway. The only thing we want in our lungs is air. We don't want mucus, saliva, water, breast milk, formula, milk, anything like that in there. And that can cause a lot of problems. So when we do decide that a thickened liquid is indicated, we generally want to have an idea of what the forecast looks like for this person who's going to be on the thickened liquids. So maybe it's a temporary solution to kind of help this person get over whatever medical hump they're in. Maybe it is a long-term solution, but we want to develop a plan for that person so everyone knows what to expect, and the patient especially is on board and knows that this is either going to be temporary or longer term. Generally, we don't want a person to be on thickened liquids long term, so it's very individualized decision to make.
Thanks, Lindsay. Kind of to piggyback on that question, would you ever consider using thickened liquids as a rehabilitative approach or technique rather than just a compensatory strategy?
Oh, absolutely. Yeah, definitely.
Excellent. I think we've gotten through most of the questions here. I'll give people just a few more seconds. If there's anything else that you would like to ask Lindsay, we can do that now. Otherwise, I'll make sure that you have our contact information and you can reach out anytime. We are recording this webinar and I'll make it available on our website by the end of the week. And after this webinar, I'll send out an email that will have a very brief survey. We appreciate any feedback that you can provide on that. And then once you complete the survey, you'll also receive a certificate of participation in this webinar. And Lindsay, I don't see any other questions coming in, so I think maybe we'll wrap things up just a little early if that's okay with you. Is there anything else that you would like to share, with us?
No, I did receive some input from one of the viewers that the Wi-Fi is maybe slow. So if for some reason you're not hearing me adequately or it doesn't get recorded adequately, please reach out to Elizabeth, who can share my contact, and you can reach out to me and we can set up a webinar. They're all free, or you can just ask me questions and I can provide more information from you.
Perfect. Thanks, Lindsay. I wasn't sure if it was your internet or my internet that was cutting out, but it was a little choppy at times. So I do apologize for that.
Okay. I typically don't have any problems here at my house, but
okay.
Who knows?
Who knows? It's always when you need it the most that it cuts out.
Exactly, of course.
Well, thank you so much for volunteering your time and for sharing your expertise with us tonight. And participants, thank you for joining us. We had people joining us from around the world, so we appreciate you being here. We do have a couple webinars in our future. The next one is next Monday already, and then we have one in September. I will send out some information on how you can register for those. Our next two webinars will be available for ASHA CEUs, and they're free to join, so we would encourage you to come back for those. And with that, Lindsay, I want to thank you again for joining us, and I'll sign off now. The ending is a little bit abrupt here, where once I click X, everybody disappears. So have a great evening, everybody, and thanks for joining us.
Thanks again for the opportunity.
Bye.
Bye.